Hi, Rachel. Good morning.
Hi, good morning.
I am just going to go, I'm going to minimize this for a minute and go get your PowerPoint. Okay, hold on.
Okay, I think Sandy also is logged in.
Yes. Mm.
Kerry, I think Sandy might also be on the same link as me because she's showing up as Rachel. Is that going to
Oh,
be
okay.
a problem?
No, that's fine. She can
Okay.
just change her name.
Hi, Sandy, can you hear us?
All right, here we go. Share my screen.
Great. So you'll do my slides then?
Yeah, so that I have your slide on the next one. So
Great.
anyway, that's just my opening slide. So what I'm going to do, Rachel, is I'm going to make you a co-host. And then I am going to give you control of the of my screen, so you'll be able to advance your own slides. How's that sound?
Sure.
Good.
Yeah.
Okay.
Will
Right.
I'll just like click on it and hit the arrow?
Yes. Okay. I am okay. All right. Do you see a little message that you, okay, there you go. Okay, great. Okay, good,
Okay,
good.
cool, thanks.
Okay, all right. So we're just gonna wait and for others to hop on. I'll be monitoring the waiting room. And I don't see Sandy on.
Yeah, let me, I just emailed her. Let me.
I mean, it's still early, so.
No, well, I think she was signing on as me, and then I emailed her. Oh, here we go. Okay, let's see. I'll email her. I think the problem is I didn't have her link, so I think I gave her my link. So I don't.
That's perfectly fine. Her name will just come up as Rachel Fichtenbaum. And then if you see near your name on the top right-hand corner has 3 dots, and you just click
Yeah.
that on and say rename, and then she could put in her own name. So.
Oh, I know what I'll do.
Yeah, so by my phone, it's 10:59. So let's wait a few minutes. See, hopefully more people are going to be jumping on. They usually do so at the last moment.
I'm happy with audiences of all sizes. So.
Okay, good. Thank you.
I'm not sure. I know I've emailed Sandy again. I know she's trying to get on. I'm not sure exactly what's happening.
Oh, okay. Good morning, Ed. How you doing?
Good morning. I'm going to go into the darkness.
Okay. Okay. Let a couple more people in the waiting room. All right. I don't see any Sandy available. But
It's okay, Kerry.
okay. We'll just let me just get the waiting room all set. All right. Okay. So why don't we get going? Good morning, everyone. Thanks for joining today. My name's Kerry Mahoney from the ARC of Massachusetts. And today I am so pleased to have special guest Rachel Fichtenbaum. And Rachel is the coordinator at MassMobility. And I'm probably not telling your correct job description, job title. I'm sorry, Rachel, you can correct me. But Rachel is just a wealth of information and works really hard to connect with communities, to make transportation, which is so difficult for so many people, available for elders, for people with disabilities, and and others in Massachusetts. So, Rachel, why don't you take it away?
Great. Hi, everyone. Thank you so much, Kerry, for inviting me to be here, and to everyone for joining us. So as Kerry said, I'm Rachel Fichtenbaum with MassMobility, here to do a community transportation update. So MassMobility is a statewide initiative. It's based in the Executive Office of Health and Human Services in Massachusetts, and we work statewide to support any organization that's trying to increase mobility for people with disabilities, older adults, or anyone else who lacks access to the transportation that they need to get around. So we do that in two main ways. By raising awareness of existing transportation options that are out there in communities, because sometimes someone is stuck at home and there actually is a transportation option they could be using if they only knew about it. Other times there is no transportation option available to take them where they want to go, when they want to go, in the way that they want to get there. So we also work with organizations to help them think about ways that they could approach expanding mobility, maybe by collaborating with other organizations. And we take a community transportation approach. So that means we're not a bus initiative or a train initiative. We're interested in anything that is available in a community that could help someone get where they want to go. And I also want to say that in this way, MassMobility, sorry, the slides keep moving, is not focused on just transportation that might be funded by a specific agency. So if you're primarily getting your transportation through a state agency, MassMobility might be able to help you think about other options available in addition that could complement or supplement the transportation that you're getting. So a really important thing to know about community transportation in Massachusetts is that it varies a lot depending on where you are. What's available varies from one region to the next, and even from one town to the next. So what's going to be available really depends on where you're starting and where you want to go. So a great place to start in terms of finding what is going to be available to help you is Ride Match, which is a statewide database. It's online at www.massridematch.org. It's a statewide database of public and private transportation options. So you can look for options available in your community two different ways. One way, by selecting your town from a drop-down menu, and then you'll get a list of public and private transportation options serving that town. And the other option is by using the trip planner. So you can actually put in where you're starting and where you want to go, and then get a list of transportation providers that can do that trip. And this tool, it was developed by a transit authority. It was actually developed with people with disabilities and older adults in mind. So right on the front page, you can also check off some accommodations that you might need for your vehicle. So then you get a list, and they tried to make it so that the cheaper options would show up first. So it'll start with public transit, and then it goes on to subsidized options like volunteer driver programs, councils on aging. And then at the end, you get taxis and livery services that might be a bit more expensive. And for each option, there's a phone number, there's a link to the transportation provider's website, so you can go and get the details, figure out if this is going to be a good option for you, and then get in touch with them to book a ride, if so. So Kerry specifically asked me to talk about COVID-19 and the pandemic and what that has meant for community transportation. And I think there's two main points. One is that transportation providers are taking steps to promote safety. This has been true since day one, but over the months, we've all learned more and more. There's more science has come out, more CDC guidelines has come out, and so transportation providers have developed some good protocols. The other thing to keep in mind is that it's been an ever-changing situation, especially at the very beginning, but this is still true, that transportation providers are making regular updates to their services. And so I always recommend, if you're thinking about using transportation, if you're planning transportation, take an extra minute to make sure the information you have is the most up-to-date information out there. Go to the transportation provider's website or give them a call. Just make sure you have the most up-to-date information. In terms of the specific protocols that any transportation provider is taking, that's going to vary from one transportation provider to the next. But I wanted to share some examples of the types of things that transportation providers are doing to keep riders and drivers safe. If you're, curious about what your transportation provider is doing, or you're feeling a little nervous, you want to get in touch with them directly, check out their website, give them a call. But these are some examples of what transportation providers around the state have been doing. So limiting how many passengers can ride together. That can help limit potential exposure. Maintaining distance between passengers so that there's social distancing on board the vehicle. That might look like assigning seats or taping off certain seats so that nobody can sit there. Taking steps to maintain distance between the driver and the passengers, or installing some sort of barrier separating the driver. Making sure the driver has masks and PPE, asking riders to wear masks as well. Ventilation, keeping windows open, or making sure that the air in the car is new, fresh air coming into the vehicle, not the same air recirculating. Instituting cleaning protocols that align with CDC guidelines, and sometimes doing screenings or asking drivers and passengers to do health attestations. Those are some examples, but again, for specific safety protocols, you're going to want to contact your transportation provider. I wanted to share a graphic from the American Public Transit Association, which is helping transportation authorities and transit providers around the country communicate with riders about safety. And I think that one of the things that has become clear for all of us in the pandemic is that each of our safety depends on all of our safety. We're really all in this together. And so it's a joint effort keeping each other safe. So this is a poster that shows some of the different things transportation providers are doing, but also asks riders to do their part in terms of following those protocols, staying home if they're sick, and so forth. Kerry? Thank you.
I apologize. When I let someone in from the waiting room, I advance your slides. So just take control back.
Okay. All right. So now I want to talk a little bit about what are some of those transportation options available in communities and how has COVID-19 affected them. So mostly I'm going to talk about community transportation options available through transit authorities because they offer a lot of the transportation options in Massachusetts. So the MBTA is the best known and biggest transit authority in Massachusetts, but there are also 15 regional transit authorities serving different regions of the state. And most, but not all towns are members of a transit authority. So we have a website, Public Transportation in Massachusetts, where you can get more information about what transit authorities offer and which towns are members of each transit authority. But overall, transit authorities offer 3 different types of services: fixed route, paratransit, and other. So I'm going to talk about each of those. So the fixed route, that's a jargon word, but it means that you can think of it like a bus. It means it always travels on the same route. There's a set schedule, you know approximately when it's going to be coming and where it's going to be. Anyone can get on. You don't need to sign up for eligibility, and you don't need to make an advance reservation. If you want to ride the bus, but you're not sure how, or you want some support, you can look for a travel trainer, which is a professional who works with people with disabilities or older adults or others to help you learn the skills and information that you need to ride public transit independently and safely. Some transit authorities offer travel trainers, and we have information about that on our website, but some human service agencies or provider agencies also offer travel instruction. And then I wanted to mention the Transportation Access Pass, which is an opportunity for people with disabilities to get a discount when riding the fixed route bus. And so that's something that if you don't already have it, you can talk to your transit authority about applying. In terms of COVID-19, transit authorities have continued to operate through the pandemic. Some of them did make changes, especially early on. Some of them reduced some of the frequency of their routes or made some changes to routes. Some of them have been bringing back some of those services over the months. So again, this really is going to depend on where you are, where you're trying to go, and you can check out your transit authority's website. Most of them have nice pages or sections devoted to any updates that they've made for COVID-19, or you can give them a call to ask questions about that. In terms of travel training, early on, most of the travel training programs did suspend their service at first. Then some travel trainers have figured out how to offer some travel instruction online or virtually. And now some of them are starting to do some limited amounts of in-person travel training again. And in terms of the Transportation Access Pass, early on, many transit authorities stopped collecting fares temporarily, but more and more of them have started up collecting fares again. So if you think you might be eligible for the Transportation Access Pass and don't have it yet, you might be interested in pursuing that to get that discount on the fixed route. Paratransit is the second type of service that transit authorities provide. Some of this is because of the Americans with Disabilities Act, which says that all Americans should have equal access to the mobility provided by the fixed route system. So if you could have taken a bus, except you have a disability that prevents you from being able to access the fixed route bus, you should still have access to that same mobility to get where you could have gotten on the bus. So if someone is not able to take the fixed route bus due to a disability, they can apply for ADA paratransit eligibility. And the law says if they are starting and ending their trip within 3/4 of a mile of where they could have taken the bus, of where the bus goes, the transit authority has to offer them an alternative ride from their origin to their destination. So if you're in the greater Boston area, you'll know this as the RIDE service. And some transit authorities offer more than that 3/4 of a mile. That's what's required by law. So the important things to know about paratransit are if you think you might be eligible, you're going to need to apply for eligibility. So you can go to your transit authority's website or call them to find out how to do that. And then if you're found eligible, you'll need to reserve those rides in advance. Paratransit is a shared ride service. So on your way, you might be picking up or dropping off other passengers. But during COVID-19, transit authorities have worked to reduce the number of passengers who are riding paratransit at any given time. And then transit authorities also offer other services in addition to the fixed route or paratransit. This really varies, again, so check out your transit authority's website or give them a call. But some examples, many transit authorities in Eastern Mass offer long distance medical shuttles into Boston, so that if you have a specialty medical appointment downtown, you don't need to find someone to drive you all the way in. You may be able to pick up a shuttle closer to your house. Transit authorities the last few years have also been experimenting with offering on-demand service, which means that the vehicle comes to you and takes you where you want to go, but you don't have to reserve in advance. You can make a spur-of-the-moment decision to go out and do something. So in Greater Boston, for a few years now, the MBTA, through their paratransit, through the RIDE, has had a partnership with Uber and Lyft, where RIDE customers can sign up to get a certain number of subsidized trips each month on Uber and Lyft. So that's one way that the RIDE has been experimenting with on-demand service. Some other transit authorities are currently experimenting with on-demand service through microtransit, which means instead of partnering with Uber or Lyft, the transit authority itself is offering the service. So an example of this is Gatra Go. Gatra is a transit authority, a regional transit authority in southeastern Mass. They currently have 2 pilots, one in the Mansfield area and one in the Plymouth area, where riders can download an app or make a phone call and get an on-demand vehicle to take them where they want to go within the service area. But instead of an Uber or Lyft coming, it's actually a Gatra vehicle, which can be wheelchair accessible with a trained driver. And FRTA in Franklin County in Western Mass has a similar microtransit pilot called FRTA Access. And both Gatra and FRTA actually use their microtransit during the early days of the pandemic to fill in some of the gaps. If they had reduced other services, but they still had riders who really needed to make essential trips, they were able to use their microtransit to help those people get there. Some of the other transportation options that might be available in your community or that might show up when you're searching ride match, municipal options. Sometimes there's services provided by a town in addition to any public transit that might be available. Councils on Aging, they tend to focus on older adults, but some of them offer transportation services, and some of them make those transportation services available to people with disabilities of all ages. Volunteer driver programs recruit people who need rides and community members who can drive, who have some extra time, and pair them up. Many volunteer driver programs did suspend their services during the pandemic, and some of them are starting to come back. There's also options like taxis, Uber, Lyft, intercity bus, commuter rail, Amtrak that can be helpful. If you're looking for transportation to a job, you can ask the employer if they offer any services or if they're part of a transportation management association, which is an organization that helps a group of businesses think about their employee transportation. Carpools, and then also driving. We have resources on our website with more information about all these types of options. And I specifically wanted to highlight driving. If you're curious if driving could be a good option for you, we have some information on our website about supports available to help think about that or get support learning to drive. In general, we have more information on our website, so I would invite you to check it out. Information about transportation options and also about how consumers can get involved in having a say about community transportation, as well as resources for staff. So anyone who's on this webinar who works at a human service agency, if you're interested in thinking about transportation that you could offer or how you could expand mobility or help consumers navigate all these different options and try to figure out what's going to work best for them, can check out our human service agencies and community transportation page or our staff training videos. We also have resources on if you're interested in offering travel instruction or if you're interested in looking for a grant to maybe pilot a transportation idea that you might have. So thank you so much. Please, I hope you'll keep in touch and I look forward to any questions you might have.
Well, I think I did that again. Sorry, Rachel. Yes, so thank you for that presentation. You know, really a lot of great information. And I know transportation's never easy, but you know, kind of checking out and thinking outside the box a little bit about how you're going to go ahead and get where you're going. So at this point, I'd like to open it up for questions for Rachel. If you just want to unmute yourself and ask a question, that'd be great. Or you could also chat it in. Just curious if anybody is using any of these transportation options that Rachel spoke about today. Whoops. Oh. I can't press my keyboard. All right then.
Hi, Kerry.
Okay, well, oh,
Kerry, it's Bonnie Thompson. Sorry.
that's okay.
Thank you very much for the presentation, Rachel. This is informative. I was trying to look at that Mass Ride Match website throughout your presentation, and it really never loaded. So just to kind of pass that on, that it seems to be in some cyber zone where you can't access it. So I was able to navigate to other sites that you mentioned, but that one is just couldn't.
Thanks for the heads up. I'll definitely pass that along, but I would also encourage you to check it again maybe this afternoon. I'm sure that it's temporary.
Okay, I will do. Thank you.
But thank you. I'll definitely pass that along in case they're not aware of that.
Okay, thanks.
Okay, thanks, Bonnie. we have one in the chat. And I'm trying to get my chat and I'm having a hard time. So Rachel, I don't know.
It looks like Kevin is saying that that he has personally used some of these transportation options.
Okay, all righty. Okay, any other questions? You know, again, feel free to unmute yourself and just ask it or raise your hand. All right.
Hi, this is Evelyn. I actually have always been proud that how well my son with intellectual disabilities. Can you hear me all right? Am I going?
Yep. No,
Yes.
you're good.
How well he has managed the T and things like that. But now with the COVID pit, I have no desire for him to be as independent as he probably could be, because I think he would have a hard time being safe on transportation. And that's the one. I'm glad to hear all these options, and I certainly will consider exploring them. But it surprises me, who has, and Kerry will know how proud I am of my son for his independence. But he's not going to have much chance if I have anything to say about it. And it goes against everything I believe in, which is letting him make his own decisions. Just a comment, not a question.
Yeah, thank you for sharing. I certainly think this, has been such a strange time that it's caused many of us to sort of rethink some of the things that we've always believed or thought about. I would say that if at any point you do want to explore, what would it mean? Are there ways that you would feel comfortable with him traveling? That the MBTA does have travel trainers, and I would imagine that this is something that they would be open to working with him on or brainstorming about. Are there any additional travel skills that would be useful in these times that maybe he didn't need before?
Thank you. That's a great idea. I will certainly follow up on that idea.
Yeah.
Encouraging. Yeah, right.
Yeah, definitely. The other thing is just, I think it's the uncertainty of, they may have changed some of their routes. So where, someone like Tom has, learned it and can totally do it, that, these unexpected changes because of COVID can sometimes be difficult to navigate for folks.
Right, good. Yeah.
Okay, so Erica has a question. Can you expand on the pilot rideshare program you spoke of, Rachel?
Sure. Erica, if you want to put in the chat if there were any of the programs you were particularly interested in. I would say generally that right now it's very hot nationally in the world of transportation, this on-demand idea. Can you get transportation that comes to you, that takes you where you want to go, but that you don't have to reserve in advance? Because from the perspective of the transportation provider, it's much easier to figure out that route if you have advance information and then you have time to make the route. So that doing it on demand is a new challenge. So you mentioned the Lyft and Uber collaborative. So I think this was the Rides on Demand Paratransit pilot. So that's available in Greater Boston. I think I can put the website in the chat in a minute. It is for anyone who is eligible and signed up for the ride, which is the ADA Paratransit for Greater Boston. And the idea was, originally, the MBTA was thinking, was there a way where they could provide additional options for their riders and they could also save money or not spend extra money? And so they figured out this pilot where they could offer customers an additional option, which was to sign up to get a certain number of subsidized Uber or Lyft trips every month. And because the Uber and Lyft trips were actually cheaper for the ride to operate than the actual ride trips, the MBTA it wasn't an extra cost to the MBTA to operate that program. So it's been a pilot for many years. It's currently extended through the end of this year. I know that they're working on figuring out, a good way for them to continue that pilot longer term. But for now, the pilot is through the end of the year. And I can put the website there. But if you're currently a ride customer, that's something that you can contact them to sign up for. If not, the first step would be to apply for eligibility for the ride. And this is a way to get a subsidized Uber or Lyft trip. So it's, you know, it's not the only way to get an Uber or Lyft trip, but it is subsidies provided by the ride. There's some other organizations that also subsidize Uber or Lyft, but it's really up to the organization whether that's something that makes sense for them to do, or if that's something that they have funding to do.
All right, terrific. Anyone else have any questions for Rachel? Okay, let me check the chat. Oh, okay, thanks. Rachel just put in the link for the on-demand paratransit pilot. And Erica says, thank you. This was great. I'm a service provider, just looking for interesting resources.
Great, and I definitely welcome any of you to reach out to me in the future as well if there's a specific transportation challenge that you're dealing with that you want to maybe hear more about or brainstorm, or check out the web pages we have also that are more targeted to providers.
It's a great resource. Thanks. Thank you, Rachel. Okay, so I think that's about it. If anybody else has a question. But I want to thank Rachel Fichtenbaum for speaking today and letting us know all about these really great resources available for folks. And, you know, it's nice to know that it's just not people with disabilities, but older Americans too. And certainly we all, a lot of us here are heading in that direction. So thank you for all this info. So there's going to be a change in our Tuesdays webinars. I'm no longer going to be doing every single week. So I am going to be merging with Leo Sarkisian. I think it's on the 3rd. We're still trying to figure it out. But so I will still do a monthly problem solving info and resource. But I will no longer be doing them solo on Tuesdays. So thank you all for joining us. I'll be emailing you Rachel's presentation. Feel free to share it. And everybody have a great day and stay well.
Thank you, Kerry. Thank you, everyone.
Thank you.
Thank you.
Thank you.